Welcome, everyone. Welcome to Maxine Hall Health Center. Yeah. That's right. Great staff, great care. We're really pleased this afternoon to get started on this big project we have in front of us. We're going to be having some seismic upgrades, a new elevator. We have a 2-story building without an elevator, so it's exciting that we'll have that for our patients and staff. We're happy to have so many city officials here with us, our mayor, our supervisor, our director of health, our director of primary care, our finance guy. You can't do things without finance, so we're happy he's here. And our patients, our patient advisory committee is here and represented. You'll hear from them. They're the reason we're here, the reason we do this. So, and then of course, Maxine Hall's family. Several members of Maxine Hall's family are with us here today. So this work really honors who she was in this community, an activist, a leader, and we want to keep that work going, caring for the people of this community. So we're happy to be here. We're excited about the project, and I want to welcome you, Mayor Breed, who grew up in this neighborhood. Yes? Please come and join us. Welcome.
Thank you. First of all, hello. There we go. This is somebody taped the microphone to the stand. So I'm just going to hold it like this, make sure that everybody can hear me. Yes, I grew up in the neighborhood, and in fact, I spent a lot of time at this school, Ben Franklin Middle School, where that's really when I was a handful. But I turned out okay, so all is good. Just remember, when any of you are working with those young kids that are a handful, you never know what's going to happen. It could be someone who just really surprises you and becomes all you ever dreamt they could be. And that's really the spirit of today and the spirit of Maxine Hall, and why I'm so excited to be here, because oftentimes we have these incredible community treasures and they get forgotten. The work that we had to do to make sure that this clinic was prioritized in the 2016 bond to help address disparities in communities around clinics and healthcare and support, it was a lot of work. And to arrive at this occasion. And I can think about, just so many amazing leaders in this community who consistently fought to help take care of, our kids, our seniors, to provide resources and services. And Maxine Hall represented that. That was the work that she did her entire life for this community, and why it's befitting that her legacy carries on through a health clinic that helps support many who are vulnerable in our communities. And so I want to thank her son Russell and all of her family members for being here today, so that we know why it's called Maxine Hall in the first place, but more importantly, the lady behind what made our community a better place for so many of us is really a testament to her legacy. So thank you again. Yes, this is happening. This is happening. No more moving up the stairs real slow. No more helping to carry people who can't walk up the stairs. We are finally going to get an elevator in this place. And let me tell you, an elevator may not sound like much to some people, but when you don't have one, and when you don't have one that works right, like we did at the Cultural Center before we redid the elevator, when people got stuck in there on a regular basis, trust me, an elevator is everything. So today we break ground on really what will be an incredible facility. Thinking about the needs of the patients that this clinic supports, thinking about the fact that, yes, there are people that have challenges with behavioral health and need a safe place to go to in the community with people who they trust, that they can talk to. I see a lot of the staff on the sidelines, the people who work to keep this place running every single day. Thank you so much for your dedication to the community, for your compassion and work and your patience as we provide the important services that our city needs. And we also need to have the important conversations around getting rid of the stigma attached to seeking out help for those who are mentally ill. people who are suffering with depression and sometimes dementia and not sure what to do, and making sure that we have places that family members can access to get people the help and the support and the treatment they need. Yes, this has been an amazing facility, and people here have made do with what they have, but now it's time to get something better. Better exam rooms to meet the needs of the patients, nicer bathrooms with new fixtures and water that works, making sure that the little things and how people feel about walking in this facility changes, because it's going to be a new facility, but it's important that people understand this is also about the people that access this facility every single day, whether people work here or they use the facility for various things, or they come by to pick up healthy fruits and vegetables and some of the great things and programs that Maxine Hall has offered for so many years. So protecting and supporting this vital community resource is critical to the success of the future of our city. And so I'm just really happy to be here today, but all is not lost. When this facility closes, to be done on time and on budget, Mohammed, we have a temporary location near Ella Hill Hutch Community Center. And so we will make sure that folks in this community know that that's the case, because just because a facility is shut down doesn't mean that the business can't continue. The business of the people and serving this community has to continue. And so again, I want to thank the staff for their flexibility and the community for their patience. And I want to at this time introduce your supervisor, Vallie Brown, who worked as an aide for me when we were fighting to make sure that if we were going to fight for this bond, that places in our community, especially Maxine Hall, need to be prioritized. And in city bureaucracy years, from 2016, passing the bond and getting it into effect and preparing and getting the project ready, to 2019 breaking ground, not bad in city bureaucracy years, not bad. So ladies and gentlemen, your supervisor, Vallie Brown.
So thank you everyone for coming. I definitely want to thank a few people. Department of Public Health, thank you for really pushing to make sure this happened and happened in a way that really cares about the community. I want to thank the San Francisco Health Network also. Department of Public Works, Mohammed, I recorded when you said, yes ma'am, we'll have that done. So I just want you to know, I'm gonna just keep playing the recording to you if it slows up, Mohammed. Mayor's Office of Disability, also very important. Reverend Brown and the NAACP was very instrumental, and Ella Hill Hutch Community Center, and of course our mayor, London Breed. You know, when I first started really getting involved in the neighborhood, it was over 20 years ago as a neighborhood activist. And I remember someone taking me aside and said, I have to tell you this story, and this was maybe 15 years ago or 10, I don't know, 12, 13 years ago, about Maxine Hall. They said, you need to know this story if you're going to be an activist. And when I heard the story and the kind of woman she was and the kind of fighter for this community, it gave me that kind of passion to do more. And when I found out her tragic, how she tragically died, and how the community said we're never going to forget her, and making sure that she was never forgotten in the work that she did, because she was selfless. And I'm sure her family will have all kinds of stories to tell you about how selfless she was, because she was actually a community person, community organizer, community activist. But for me, that gave me a path forward also of how I should push forward, how I should never take no for an answer. And it also is a little bit personal for me, because with this center opening, you know, I grew up, a lot of you know, in Utah, half Native American, on and off reservations my whole life growing up. And my mother, we never had health care, ever. If I ripped open my knee, I actually went to the vet to get it sewn up because it was cheaper. And when I was 14 and my mother had just turned 40, she passed away because she had undiagnosed diabetes. and she had no idea. And I always think to myself, if we had a Maxine Hall somewhere along the path of our journey, that she could have gone and gotten just a checkup. She never got a checkup. If she could have gone and had that checkup, and that she would have probably, lived on, and her life was cut short at 40 years old. So when I think about healthcare, and I think about, healthcare for all and justice, I feel that this is something that I fight for every day because it's personal to me. So I want to thank Dr. James for all the work you do, because I know it's not easy. Yes, thank you. And your staff, amazing staff. And I also have to tell a quick little story. When we were looking for a space to bring some trailers, so Maxine Hall would not close down, there was one area we were looking at, and I won't tell you where, but we got a huge pushback from the community. And I said, what? Why? This is an amazing community center, health center, but we got a pushback. Didn't want it. So thought about it, worked with Reverend Brown and a few others and Mayor Breed, and we said, why don't we take it next to Ellie Hill Hutch, right in the community of Maxine Hall? And we went to the Ellie Hill Hutch community around there, and I'll have to tell you, everyone was excited and said, yes, bring the trailers here so services will continue. So I want to thank the community for being so open when we need to have those kind of a direction to make sure that everyone gets service. So thank you everyone for coming on this lovely day. And I think I'm gonna take you over. Okay, thank you.
Thank you. Yeah, we definitely want the teens coming over, especially the rowdy ones. Bring them over and say that now. Yeah, oh no, bring them on, bring them on. That's right, and we want to acknowledge James, who's at Ellie Hill Hutch, and they're welcoming us. I don't know if the Reverend's here, but we've learned a lot from him too in this process, and Roland Pickens, who helped us with that as well. Thank you, Roland. So I want to welcome Grant Colfax to the stage, who Dr. Colfax was a resident here at Maxine Hall. Just want to say one of our longest serving staff member is Tanya Thompson, who's been here for 30 years. She started at the age of 4. Yeah, all right. And she was one of the people who welcomed Dr. Colfax when he came as a resident. So she built his templates. She had him seeing patients from the get-go. So Dr. Colfax, thanks for being here.
Well, good afternoon, everybody. Thank you so much for being here for this exciting day. And Mayor Breed, I'd just like to thank you and your leadership for making this happen. Supervisor Brown, thank you so much for your support. Mohammed, your department is key and crucial in moving this forward. And I really want to thank Roland Pickens again for his leadership in the Health Network. And most of all, the team and the staff here at the clinic who do the work every day. I actually came back to the clinic a couple of weeks ago, and I was here as an resident in 1994 and learned so much from some of the people who are still here. And I think the thing that still stands out for me is the remarkable dedication that everybody has to the community, and most importantly to the patients that get the care here that they need. I think the work around integrating care, around integrating mental health with physical health care, the fact that there's a methadone clinic adjoining this clinic, the wraparound services that we provide, the focus on health equity, and the focus not only on the individual, but also the families and the community. I think that's the legacy of Maxine Hall, and I think that's the legacy of this clinic. And now we're going to turn the physical aspects. The clinic hasn't changed that much since I've been here in terms of the physical piece. And I think where you get your care and what that environment looks like, we know that healthy environments improve health, right? Healthy environments, positive spaces improve mental health. Help address people who are struggling, help address the needs of people who are struggling with substance abuse, decrease stress levels that can help with diabetes, that can help with hypertension, and bring community together. So I'm just so thrilled to be back and see what we're going to be able to do here in 14 months. Is that 14 months on time and on budget. So thank you for your leadership, and let's get going. Thank you.
Thank you. And now I think we have Director Nehru, who's going to
Thank you.
say a few words.
Thank you, Dr. Catherine James, and thank you to the Health Department. I mean, we have developed a very great, long-standing partnership. We have delivered many projects together. You know, of course, the biggest one, the Zuckerberg Hospital. We have projects in the Southeast Health Center coming up pretty soon, the renovations that are coming up there. Potrero Hill Health Center is also is on our list, and so we are excited. On this project, I mean, we're doing pretty much everything. The project management, the construction management, architecture, landscape architecture, plumbing, everything is all going to be done by the public works staff. So we're excited that we'll be working on that. The funding, as you heard the mayor say, actually came from the 2016 Public Health and Safety Bond, which is very important. So I want to thank the voters for making that funding available to us. I think some of the key elements you heard about, having an elevator makes a huge difference, so we're excited. We'll be getting a new elevator. We'll be making the building seismically safe. And seismically safe means that in the event of an earthquake or in the event of any disaster, the building will be operational for up to 72 hours or more. So we're excited about that. New consultation rooms where when people come to use the facility, larger exam rooms, really everything that we can do with the funding. We're excited about that. I would like to thank our project team, Ron Alameda, Joe Chin, and all the staff from Public Works for working so hard to get us here. And of course, our contractors who are working on this, we have several contractors, Ansari Engineers, BAC, and Bill Group. They're going to be making sure that we deliver the project in the 14 months that we promised, and that will be winter of 2020. So I'm excited, and I'm going to make sure it gets done on time and on budget. Thank you very much. Yeah.
We want to hear from one of our patients. I just want to let you know that our patient advisors are a group of people who bring a lot of wisdom to us, and we've leaned on them over the years for many things, and we're really grateful for the work they do. And we want to hear from one of them now, Mr. Dan Jordan. But I just want to take a quick moment to show you some of their amazing work. This is a pamphlet that they created for our patients so they could know how to best access their care. And it was very thoughtfully done, and we give this to all of our patients when they come and join our team here. So thank you for that, Mr. Jordan, and thank you for being our patient
Okay.
and coming today.
Thank you, Dr. James. I'd like to say I've been a patient here for a little over 23 years, and I've received the best of care, and I've been to a number of the other clinics and hospitals here. Maxine is above all of them, by far. I'm also an activist, and I work with the Central City SRO Collaborative, which I'm sure Mayor Breed knows about. I've been there for about 10 years. I'm a housing peer counselor. I'm also on the board for the PAC committee here, and new member of the new citywide PAC team. And also I have been on the SRO task force for 6 years. The clinic, the remodel is something that we have desperately needed, and now we're getting. So it's been a long time coming, and I know since I've been on the board for the past 2 years, every meeting is about the remodel work, and we're glad to see it finally coming together. Thank you.
So I think that concludes. We have to have our raffle though. Marty Sella, who's made all of this come together. Her mother's a talented artist who put together some beautiful, succulent pieces for us. So I would like Miss Charlene Hill, who is Maxine Hall's daughter, to do the honor of pulling out the names. All right, let's see. I have my glasses on, but they're not as nice as yours.
And I don't have mine
Okay.
on.
So, Ms. Rosalind Frazier.
Oh,
You want me to sure you go home
Me
with
and
one.
Rosalind grew up together.
Okay, they grew up
So we
together. There
should
you
share
go.
this.
That succulent's going to spend some time in her home too. So let me take another for us. And that is Matthew Rothschild. Matthew Rothschild. Okay, Mr. Rothschild. I think that he's not. Okay, all right. Is he here? We almost gave it away. So I have one question for people. What's 1181 Golden Gate? Who can tell me what 1181 Golden Gate is? 1181 Golden Gate?
The new location for the clinic.
That's where we're going to be for the next 14 months. So please come and visit us there as well. We're counting on our patients to be with us. And we'll have you back in 14 months and 2 days for the celebration. And he's bringing the champagne, so don't miss it.
All right, here we go. 5, 4, 3, 2, 1. Turn that